During this pandemic, we've been inviting local medical professionals here at Channel 5 to answer your questions about the outbreak. All you have to do to ask your question is text it to the number on your screen. That's 479-785-5055. Our guest today is Dr. Lisa Lowe, Mercy's medical director for community health. Dr. Lowe is a family physician who's been practicing with Mercy for more than 20 years, and today she's taking your questions about COVID-19. Doctor, thanks for your time today.
Thank you very much. Thanks for having me.
So we know that, like many other hospitals, Mercy established a site where people can get tested for COVID-19. How have things been going at that testing location?
Very well, actually. So we established our site at an old construction trailer just at the bottom of our hill. People do have to call ahead and be pre-screened on the phone before they can get an appointment to come to the center. But so far, we've tested about 730 patients, and we've had over 3,000 phone calls since March 20th.
Talk a little bit about the requirements for testing. Have they changed at all, and what are those requirements right now?
Well, basically, in order to be tested, you really have to have symptoms. So a fever, cough, or shortness of breath, and then one of several other risk factors, including travel, being a healthcare professional, being in contact with someone with COVID-19, or being in a high-risk category, over age 50, or with a chronic illness or immunocompromised. And they haven't really changed, but we've had to be fairly strict about those criteria just because of the limited number of testing supplies that are available to us.
Is that the biggest reason why those requirements are so narrow right now?
Mostly, but also because the test or any test is going to have a false negative rate. So no test, a medical test, is 100% accurate. But if you're going to test asymptomatic people without symptoms, you are going to have a higher false negative rate. So people without symptoms really should not be tested. And that's pretty much national guidelines at this point, and we're following what most other testing centers and health systems are doing as well.
What about those people that are showing symptoms, but maybe they don't classify as a higher risk, or they haven't had that known contact? We have talked about, obviously, the known instances of community spread. So why do you need to know that you've had contact with someone when maybe you have had contact and you just don't know, but you are showing those symptoms?
Right, that's a great question and something we've been discussing ourselves internally. If you're sick enough to be admitted to the hospital, then you will have a test for sure. And so in the community, that's a difficult question, but mostly it's just because we just don't have an unlimited supply of tests to be able to test everybody. We wish we could, and you've heard that the FDA has approved new tests, and we're hoping, in a few months that things will change and that we will be able to do that. But right now, it's just mostly a matter of supply.
With that supply concern, how accurate do you feel like the testing numbers are when we talk about the peak here in Arkansas? Do you think the lack of testing can change those projections at all?
Oh, absolutely. I think, as far as some of those counties with only a few positive cases, that's probably just because only a few people were tested. So we were able to test quite a few people in Benton County. At our center, over 700, and I know other people are testing as well. But sure, I think there's probably a lot of community spread that we don't know about.
We've also heard that it can take some time to get test results back depending on who is doing that testing. Is that getting any faster?
That is actually. At the beginning, we had about a 5 to 6 day wait for test results, and now we've moved to using a different lab, and we're getting results back in about 48 hours, 72 hours at the most.
When we hear the governor's news conferences every day and Dr. Nate Smith addressing testing, he talks about the use of commercial labs versus the use of labs at the Arkansas Department of Health and also UAMS. So to be clear, when Mercy sends off those tests, they are sent to those commercial labs, correct?
Yes, absolutely. That's right.
Okay. We'll have more viewer questions for you coming up in just a moment. First, though, we're going to take a look ahead to your forecast. Sabrina, thanks. Today we are joined once again by Dr. Lisa Lowe with Mercy Hospital. She is the medical director for community health, and we are answering your questions about the COVID-19 pandemic. Doctor, we want to start with the development of guidance. We've learned that you guys have helped develop guidance for employers regarding COVID-19. Why did Mercy do this, and where did you start with this process?
So we get a lot of questions from patients and from employers about what they should do if somebody is sick, about who qualifies for testing, about doctor's notes and work excuses. So we decided to really look to the CDC guidelines and to pull out all of the relevant information that the CDC has actually published about this and put that into a concise guidance document for local employers.
So if an employee has been sick, do you recommend that employers require those employees to have a COVID-19 test before returning to work? And do you recommend that they get that doctor's note?
Right. So that's the question that comes up. And no, unless they meet the criteria that we talked about for COVID-19 testing, they won't be able to get a test because they don't meet the criteria. And so it's really important for employers to basically just follow they used to do before this happened. So if somebody is sick, they shouldn't be at work. They should be fever free for at least 48 to 72 hours. It's important to remember there's lots of respiratory illnesses going around besides COVID-19, so we just encourage people to use their best judgment about respiratory illnesses.
Sure. If an employer has an employee who calls in and says they have a fever or arrives at work with that fever, what should the employer do?
Well, a lot of employers are screening employees with a temperature, as they're entering the building. And so what we said is we'd really like them to give that employee a note saying what the temperature was. And 100.4 is what we're using here at Mercy to screen our employees. So anything below that is really not considered a fever. So someone shouldn't be sent home just because they have a 99 or a 99.5. But they should give that person a note and have them call their primary care provider for further guidance. That's really the best thing to do.
Okay. On the employee side, if an employee thinks they might have been exposed to someone with COVID-19, what should they do?
Well, that depends on whether they're sick or whether they're not sick. So if somebody has a known exposure to a person with COVID-19, and then they themselves start to get sick with a cough, shortness of breath, fever, then they should call a screening line. We have our own Mercy COVID screening line or their primary care physician's office for guidance to figure out what to do. And then they should stay home if they've been exposed and they start to have symptoms. If they don't have symptoms and they think that maybe they were just in a restaurant with somebody, well, I guess there's no restaurants right now, but in a bank or Walmart or something, then what they need to do is monitor themselves for symptoms.
So at that point, though, the employee still could go to work even if they are potentially a carrier for the virus but aren't showing symptoms?
Right. And so actually the CDC just came out with some new guidelines for essential workers, healthcare workers. And so even in our situation, the recommendation is that somebody who thinks they may have been exposed but it's not sure, or maybe had some kind of contact, should monitor themselves for fever once or twice a day, and then they should probably be wearing a mask, or actually for healthcare, we should definitely be wearing a mask to work, and then maintaining social distancing and watching for symptoms. But yes, they can continue to go to work as long as they practice those guidelines or follow those guidelines.
Okay. I guess the confusion comes where we've heard that people can still have the virus and not show symptoms, or they can have the virus and show symptoms. And so why would someone that has symptoms or not have symptoms be treated differently?
Right. And it gets a little nuanced also because it depends on the exposure. So let's say you have an exposure to a close household contact, somebody you live with, or somebody that you've been in very close contact with at work, that person gets sick, then the health department would probably ask you to stay home for 14 days because there was a close contact. But what really mostly comes up is not close contacts, but just something where, somebody might have been in the vicinity of someone else with COVID-19. And so that's where monitoring yourself for symptoms is really going to be the best thing, because otherwise, it's just not practical. Otherwise, I think is really the problem.
Sure. Should individuals also be monitoring their own contacts and keeping kind of a record of where they've been? Is that something that would be helpful in this process?
I suppose, especially now that we're all staying home most of the time, if you've been around somebody that's been sick, then you should probably monitor yourself a little closer. Be checking your own temperature. That would be recommended. But the guidance is really for close household contacts or people that you've been in really close contact with.
Okay.
Yeah.
Generally speaking, how long will an employee have to stay away from work, whether they've been diagnosed with COVID-19 or they were suspected to have it but didn't meet those testing requirements?
Right. So if somebody has COVID-19 and they've been tested and they're positive and they're isolated at home, which is going to be most of the time, they're not going to be in the hospital. Actually, the guidance says that they can go back to work, believe it or not, um, 7 days after the symptoms started, and if they're symptom free for 3 days. So if they have a really mild case, the minimum time is 7 days. But then they also have to be symptom free, including a fever, for 3 days before
Okay.
they go back to work.
What
Yeah.
has been kind of the average length? That sounds like maybe the best case scenario.
Right. Probably 2 to 3 weeks.
Okay.
hmm
Talk about what employers should do if they hear someone that was later diagnosed with COVID-19 had been in their business. Are there steps that they can take?
Well, cleaning is going to be very important. And so I think that most of the employers have good cleaning guidelines. So they should clean, deep clean everything. They should probably notify their employees, but that's a situation where they should not send all of their employees to be tested. Excuse me, because that's probably not going to be possible. And so they should ask people to monitor their own symptoms. Wearing masks, if that's possible, would probably be a good idea. And looking for the development of symptoms.
Okay, thank you so much. That's some great guidance on what to do with employers right now, especially as everybody is trying to navigate this and figure out what to do. We appreciate it. We'll have more questions for you coming up after this break. Back now with Dr. Lisa Lowe, the medical director for community health at Mercy Hospital. She's been taking your questions about COVID-19 this afternoon. We've heard a lot of healthcare systems are offering virtual doctor's visits. So what has been your feedback from patients about telemedicine at this point?
Well, some of them really love it, and some of them are having trouble with the technology. So, but no, I think overall patients have been very receptive. They're very grateful not to have to go into a clinic or their doctor's office. It's sometimes more efficient for them. But yeah, we've had mostly great feedback so far.
Have there been certain instances, though, where patients still do have to come in? Obviously, there's some medicine you just can't do when someone's at home, right?
Sure, exactly. And one of the things we did do was we converted our convenient care to a respiratory-only clinic, and then asked patients with non-respiratory symptoms to be seen at some of the other urgent cares in town, just to sort of consolidate that. And so
Sure.
orthopedics would be a great example of where you just really need to come in.
Right. Talk about what's the most common question that you're getting from patients during this uncertain time?
How long will this last?
Sure.
Right. Yeah, and people are worried if they're at high risk. A lot of people are worried about potential exposures. Something that I like to call secondary exposures. So, my babysitter's husband, might have had a friend, that type of thing.
Right.
So that we usually just try to reassure people that that's too far,
Yeah.
and so you don't need to worry about that.
Good. A friendly face. I'm sure they appreciate it. We'll have your final thoughts after this break.